My name is Hilaria Ashivudhi, and I'm going to present an abstract titled Striving Toward HIV Epidemic Control Through Reaching a Population in Correctional Facility in Namibia. Introduction. Namibia is striving to reach HIV epidemic control and has made a significant stride in responding to the HIV epidemic, with 86% of people living with HIV know their status, 96% of them are on treatment, and 91% are virally suppressed in general population. Despite this great improvement, there's still a population that needs to be reached in close setting, like correctional services that the ministry has to reach in order to attain epidemic control. Objective is just to identify the gap in the provision of HIV/TB care services in correctional facility through site assessment and implement improvement intervention. So the process used is that a SIMS tool was developed by PEPFAR to assess the quality of HIV care services was adapted and used. Assessment was done between July and August 2019 in all 14 correctional facilities by the team from the Ministry of Health, NCS, and CDC. Interviews were conducted to the healthcare workers and program officers in correctional facility. Review of monthly and quarterly report and relevant record was done. Visiting in the living quarter of offender was also done, and the results were used to identify gap and implement the improvement intervention. Also, a color coding scheme was used to rank finding: blue, which means it met the expected standard; yellow, need improvement; and red, need urgent intervention. So, on the result, the occupancy rate was 81%, and 12% of them were found to be HIV positive and on ART. And all 14 correctional facilities were offering basic HIV and TB services. And DOT services was offered in 13 out of 14 facilities. And the services that were assessed was testing, treatment, prevention services, TB screening and care, STI screening, and commodity availabilities. So the result, it shows that Elizabeth Nepembe was the one with the highest score of 88% of services provided there, and Ludres with 40% services that is provided. In conclusion, the assessment was one of the initial steps toward identifying the gap in the provision of HIV quality and services, and the ministry, in collaboration with NCS, has developed and implemented the improvement plan to address identified gap in an effort to reach total epidemic control. So acknowledgement, we just want to acknowledge the Ministry of Health, Directorate of Special Programs, Center of Disease Control Namibia, and the team from Correctional Services. Thank you.